The opportunity now to take you to Washington, D.C. to speak with the Secretary of Health and Human Services, Dr. Tom Price.
Dr. Price, thank you for your time today. We really appreciate you. Yes, thank you for being with us. And
Lori, Calvin, thank you so much. Good to be with you.
It is our pleasure. What is your first advice to people who have seen what happened in Houston with Harvey? What do you say to people who are here trying to wait out and ride out this storm, Hurricane Irma?
Yeah, this is a different kind of storm. This is a storm of a huge proportion. The width of the storm, as you all have been describing, is over 300 miles. That means that if the center of it goes up the Florida peninsula, that it will stretch beyond the east coast and the west coast of Florida. So everybody within the state of Florida, as the governor has been describing and as your emergency personnel have been describing, is in the path of this storm. And so people need to take all the precautions that they can and heed all of the warnings that have been offered by the local individuals. From a federal standpoint, we're leaning into this. The president declared an emergency, and here at Health and Human Services, we've declared a public health emergency, which allows us to pre-stage assets to make certain that we can respond to whatever might happen given the storm that's coming.
And Congress has passed a $15 billion package. Does that really incorporate Hurricane Harvey victims as well as Hurricane Irma?
Yes, it does, and that'll be just enough to get us through the worst part of Irma, and then a little bit of the recovery phase, I believe. As many folks have talked about, this will require multiple supplemental appropriations bills so that we can have the resources to have the federal government respond and help the local and state communities to make certain that they're able to respond in the way that's necessary to get folks back up on their feet once this storm passes.
And Dr. Price, what is going to be FEMA's role in all of this, assuming that Irma does make landfall, and by Monday we're going to be looking at her aftermath?
Yeah, FEMA is the federal organizer for all of these things. We follow direction from them. They will be directing the assets and directing the personnel, the emergency personnel. We've got disaster medical assistance teams. We've got federal medical stations that we will likely be needing to set up at some point as the storm comes through. And once it does come through, then the local folks contact FEMA and the state folks contact FEMA to let us know where to move those assets so we can be most responsive to the individuals in need once the storm comes through.
When we hear about the numbers of FEMA and National Guard and our own power company, they all are telling us that they are more prepared for this storm than they've ever been in the past. Do you feel confident that Florida is prepared?
Well, I think Florida's done a remarkable job, and again, I want to commend the governor and the state officials. They've done all that they could to make certain that folks had the knowledge that they needed to get prepared for this storm. But we haven't seen a storm of this magnitude in decades, and there's some people that are saying this will be the largest, the most destructive, potentially the most destructive hurricane that has ever hit Florida. So it's important that people heed those warnings. I know that Floridians are strong folks, and I know that a lot of them want to ride it out, but it's important that individuals heed the warnings that are being given by the local folks and make certain that if you've been told to evacuate, that you get out and get to a sheltered area.
And Dr. Price, for those people who are remaining, what is the one piece of advice that you would give them soon after Irma leaves the South Florida area, begins to head northward into Georgia and South Carolina, North Carolina? What is the one piece of advice soon after Irma hits us?
Well, a couple things. There's still, if folks are going to hunker down, and that's not recommended, but if they are, then they've got to make certain that they're able to take care of themselves for 3 to 5 days at least. No one knows how long the power will be out. No one knows how long it will take for the emergency personnel to get in. Once the storm passes, then it's important that neighbor help neighbor. So you've got to knock on neighbors' doors, make certain that people are all right, make certain that you're getting the kind of assistance to individuals who need it. We will be coming in as rapidly as we can once the storm comes through. We've got assets that are pre-positioned not just in the Panhandle or in Georgia, but we'll be using folks from Texas and even on marine assets that we'll be bringing into the area. So we'll be getting folks in the southern half of the state as the storm continues to move through the northern half of the state. But it's important that people heed the warnings that are being given by the local folks.
We have had a lot of warning to this, but that also makes people very anxious, Dr. Price. I mean, simply speaking, medically, what can we all be looking out for with our friends and relatives, the elderly? What kind of symptoms occur if someone's getting especially anxious or really preceding a medical problem?
Yeah, this is one of the reasons that I wanted to come on today and just share this message, and that is that the federal government has been responding to all needs that have been asked for, that we are leaning in at the president's direction just as hard as we can on this. We're as prepared as we can possibly be for a storm of this magnitude. Now that doesn't mean we can stop the storm, but it does mean that as soon as it passes through, that we will be bringing all sorts of individuals and assets to bear to make certain that we're able to care for folks. For those individuals who are seniors, you've got over 4 million seniors in Florida. For those folks who are dependent on medication, make certain that you've filled your prescriptions. So you still have an opportunity and time to do that. Make sure you've filled your prescriptions, that you're able to, again, withstand that 3 to 5 days where there may be a real challenge in getting power and resources and capability to wherever folks are in the state if the storm comes right up the middle.
Dr. Price, I know you have a keen interest on what Irma does, especially as it possibly heads toward Georgia, the state you represented in the U.S. Senate. So thank you for your time. We really appreciate you, and we hope to talk to you soon.
Thanks so much. We're thinking about you. God bless.
All right. Take care.